Congratulations on receiving your offer of a place on the Midwifery Education Programme at Queen's University Belfast. My name is Gail Anderson. I am the Programme Lead for the BSc Honours in Midwifery, and I am delighted to welcome you to this session, which will provide a brief overview of what it's like to study midwifery at Queen's. Our vision within the university and the School of Nursing and Midwifery is the provision of a community learning environment which is committed to excellence in teaching, research, scholarship and clinical practice, and that which will contribute to local and international efforts to improve the health and well-being of every individual member of society. And this aim resonates very well with our programme of study within the School of Nursing and Midwifery, which has a focus on theory and clinical practice in order to make a difference for women, their families, and also the wider community. So moving on to where the School of Nursing and Midwifery sits within the wider university, you'll see from the slide that the university has three faculties. So we have the Faculty of Engineering and Physical Sciences, the Faculty of Arts, Humanities and Social Sciences, and then the Faculty of Medicine and Life Sciences. And it is within this Faculty of Medicine and Life Sciences where the School of Nursing and Midwifery sits. And we share this faculty with the School of Medicine, Dentistry and Biological Sciences, the School of Biomedical Sciences and also the School of Pharmacy. The School of Nursing and Midwifery at Queen's is unique in a few ways. It is the only school in Northern Ireland that offers midwifery education. It is also the only school in Northern Ireland that provides education for all nursing disciplines, which includes adult, children's, learning disability and mental health nursing. And in addition to which, it is also considered to be the largest school within the university, offering education for approximately 2,500 students. Within that, we offer two pre-registration programs for midwifery. So we have the BSc Honours in Midwifery, which is the 3-year direct entry route, and this is the program that you have been offered your place for. And we also offer the 2-year MSc midwifery route, and this provides midwifery education for those who previously completed a degree in nursing. In comparison to the nursing cohorts, midwifery in itself is relatively small. Our cohorts of student midwives are approximately 80 students per cohort, whereas the nursing cohorts would have in excess of 400, close to 500 students. Our overarching aim in providing midwifery education at Queen's is to equip you with the knowledge, skills and attributes to deliver women and family-centred care that is both safe and effective. Our values are the attributes which underpin our aim in delivering midwifery education at Queen's. They are attributes that we expect our midwives to demonstrate at the completion of their education, and they are important to us as individuals as well as to the profession and also to yourselves on a personal level. So the programme you have applied for is a 3-year full-time education programme. It generally equates to 50% of your time spent in theory within the university setting and the remaining 50% in clinical practice. You will be allocated to a specific trust for a period of time, but be prepared to practice in any of the 5 health and social care trusts across the province, and this is dependent on placement availability as well as the experience that you may need to acquire during the programme of study. Generally you have 3 placements per year, and in first year, as you can see from the slide, the clinical working hours for yourselves would be 30 hours per week, and then that rises incrementally to year 3 when you'll be working full-time hours. You would also follow the normal shift patterns depending on where you've been allocated, and that could include working weekends as well as night duty. You will be supported in clinical practice by a nominated practice assessor, and you will also have the support of practice supervisors. And then additionally, you will have the support of a link lecturer and an academic assessor, and these two roles are normally fulfilled by members of the midwifery teaching team. You can expect world-class teaching at Queen's from experienced midwifery lecturers and also from our colleagues from clinical practice, who not only teach and supervise students in the clinical area but also contribute to theoretical teaching within the university environment. Midwifery lecturers are also involved in research projects within the school, which is integrated within our education programmes, and that ensures that our programmes remain current or up to date and have a firm foundation based on the most up-to-date available evidence. As a midwifery teaching team, we're relatively small and we're led by our lead midwife for education, Dr. Jenny McNeil, and you will have an opportunity to meet members of the midwifery teaching team during the Welcome Week in September. The midwifery teaching team are here to support you during your learning journey, and you will be assigned a personal tutor at the beginning of the programme, and the personal tutor will provide you with pastoral support and also help signpost you to additional learning resources as well as mechanisms of support should you need them. So as we come towards the end of this session, I am delighted to be able to share with you that in August 2021 we opened our state-of-the-art simulation centre, which is based in the Medical Biology building. It is a cutting-edge interprofessional training facility which will offer you the opportunity not only to practice your skills with your midwifery colleagues, but also to practice with other professionals from within the Faculty of Medicine and Life Sciences. It will offer excellence in your midwifery education journey, and also underpinning that will be driving safe, effective and collaborative care, because it will provide a safe environment in which you can practice those emergency skills, for example obstetric emergencies that may occur in clinical practice but that you do not deal with on a regular basis, and therefore the opportunity to practice with other professionals in that type of situation is invaluable. As a midwifery student, you are commencing on a journey of lifelong learning, which will continue beyond the point of registration. So the school offers, in addition to pre-registration education, we also offer post-registration opportunities, and these can come in the form of continuing professional development, such as standalone modules, examples being the ultrasound scanning course, and we also have sexual health modules, breast and cervical screening, family planning, for example, and also a module covering sexually transmitted infections. Or you may be interested in undertaking a short course following your qualification as a midwife, and that might be in the form of the neonatal practitioner's course. We also offer higher degrees, so you may wish to, following registration, commence an MSc in Advanced Professional Practice in the theme of maternal and child health, and ultimately we also offer then the opportunity to study at doctoral level. Again, that would be with the theme of maternal and child health research. Finally, I would just like to thank you for your attention and consideration of undertaking midwifery at Queen's University. And if you have any other inquiries or questions, please do not hesitate to contact registry at the email given below, which is ner.registry@qub.ac.uk, and I look forward to meeting you come September.